And what I found is that the evidence for surgery is often lacking. And perhaps nowhere is this better seen than in the field of spinal surgery, where much of what is done, and I still see spine patients. I used to do spine surgery, but I stopped doing that now. I do other types of surgery, but the results are not as good as we think they are, and a lot of it gets done for spurious reasons. The problem is that we tend to overestimate the effectiveness of it, and we tend to downplay the harms, which has been shown in research that that's what we as surgeons tend to do. So I'm trying to inject a bit of reality into the perception of surgical effectiveness.
You spend a lot more time trying to actually, instead of just offering the surgery and moving on to the next step, it seems like you, just like anyone else, it actually takes a lot of commitment and time in front of the patient, a lot of face time to actually get them to that realization.
Yeah, so a lot of surgeons say that it's easier to just recommend the surgery and fill in the form than it is to explain to somebody why they do not need surgery. I'm not sure that I agree with that, because I've spent a lot of time explaining to people why they don't need surgery, and you can become efficient at doing that. But when you say to the general layperson that, well, a lot of surgery doesn't work either, that's difficult for them to match up. It doesn't make sense to them. So to try and offset some of the hype around surgery and robotic surgery and all this kind of stuff that we're hearing about these days is another reason why I wrote the book.